My name is F22.Helvie and I'm doing a case study on a 45-year-old female. She weighs 120 pounds and she is 5'2", which is 62 inches. I put her in the left column of this chart because she has been physically active for over a year and at least 5 times a week. She also works out for 60 minutes a day. She has no known metabolic, cardiovascular, or renal diseases, so she does not need medical clearance, and she can continue moderate to vigorous intensity of exercise. Her age is not a risk factor because she is younger than 55 years old. Her family history is a risk factor because she reported myocardial infarction, coronary revascularization, or sudden death before the age of 55 in first-degree male relatives or 65 years in first-degree female relatives. She does not smoke or in an environment of smoking, so that is not a risk factor. Physical inactivity is not a risk factor because she exercises more than 3 times per week for at least 30 minutes and for over 3 months. Her BMI is within a normal range, so it is not a risk factor. Her blood pressure was 115/75, so she is within normal limits, and this is not considered a risk factor for her. Her lipid count was not a risk factor because it was below 130. Her fasting blood glucose level is a risk factor because she did not report it on the paper. Her HDL-C was lower than 60, so she does not get a positive risk factor. Her total risk factors were 2, being her family history and her blood fasting glucose level. Her BMI is 21.9, which is considered normal. Her fat percentage was 16.1%, and this puts her between the 90 and 95th percentile. We take the lower number, which would be 16.8, because she doesn't meet the 15.2 requirements. Her VO2 max was 60.2, which is higher than her average age range. This will put her at the 95th percentile and at the superior ranking. Her grip strength was 36, which was in the 95th percentile. Her bench press was 85 pounds, and I found her ratio by dividing her weight she pushed, which was 85, divided by her body weight. And this puts her at the 90th percentile and at the excellent ranking. Her leg press was 200 pounds, and I found her ratio by dividing that 200 pounds she pushed by her body weight. And she is in the well above average category and the 90th percentile of her age. She only received a 4 on her push-up test, which was extremely low. This put her in the poor ranking. Overall, she is a healthy individual, but some areas of concern would be her family history. It doesn't go into detail about it, but she reported history of either myocardial infarction, coronary revascularization, or sudden death before the age of 55 in first-degree male relatives, or 65 years in first-degree female relatives. Another concern was her push-up score. Every other test she took was either in the excellent or above average ranking, except for her push-up score.